Hi, everyone. Welcome into Primetime TV Show. I'm your host, Barbara Marville Kelly. Thank you so much for joining us. We gave my other half of the show, Dennis Kelly, the day off. And of course, we made this whole show about wellness with my very dear friend and colleague in the wellness arena, Dr. Mary Kelly, who is a doctor of Oriental medicine. We've been talking about this for a long time, haven't we?
We have, Barbara, and it's so great to be here today. Thank you for having me. The staff's been wonderful, and I just love what you've done with the place. It looks great here.
It's pretty easy, right?
Yes, yes, definitely.
Dr. Mary just walked right in and just found her place in the chair, and we've been talking about doing this for, gee whiz, about a year and a half, because I think it's so important to share alternative ways to wellness out there in the world. And of course, our Primetime TV show is all about that. Dr. Mary has been actually, you started out, I want to hear your story about how you started out in acupuncture. And by the way, Dr. Mary is board certified, which was something I did not know was one of those qualifications that you really went all out, studied in China.
Oh, absolutely.
And
absolutely.
You really put your heart and soul. How did you get started with this?
Gosh, I'm going to say 30 years ago, I started as a patient of
Really?
acupuncture. I was curious about what it could do. I had some issues, and I knew if I went to a traditional Western doctor, the family practitioner, that I was just going to get a prescription.
Okay.
Okay, and that's done in a couple of weeks or a couple of months, and then in most cases you still have the problem.
Yes.
So I didn't want that runaround. So I actually sought out an acupuncturist. Back then, everybody who did acupuncture spoke Chinese. They were Chinese. There was quite a communication problem. And I was amazed as to how to communicate my problem to someone who didn't speak English. And I didn't know how that was going to work, but I took a chance and I went in, and it was a female practitioner. And it took me a couple of visits to realize she didn't understand a word I said, because she kept saying yes and agreeing to everything. We were just going along with it, but I felt results right away.
And this was with a doctor of Oriental medicine that didn't understand English.
Correct, correct. And I'll explain how that works. That
I'm like at a loss.
me.
This is interesting.
That mystified me, absolutely. But I could tell I was getting better. I could tell the treatments were working. I knew nothing about it back then, and I didn't even understand how someone would know where to put the needles. She quite often came in with this little wooden box that was smoking. Something was in there on fire, and that was kind of scary. I didn't understand moxibustion. At first, I wasn't sure what was even in the box. So I just loved what it could do without drugs, and that's what impressed me. So that just convinced me from then on to be a patient of alternative therapies, and specifically acupuncture, and quite often that goes with Chinese herbal therapies.
So can you tell me, I have to back up a little bit.
Sure.
What is moxibustion?
Moxibustion is an herb. It's not one herb. It's actually an herbal formula that looks, I don't want to say similar to marijuana, but it looks in a bag. It just looks like loose, dried, greenish grass. And it's actually burned near acupuncture points. So the heat gives a very tonifying effect. It increases circulation, and it gives an overall feeling of wellness and warmth in that particular area of the body.
Now, you've done that on me, I believe.
Oh,
I forgot what that
absolutely.
was called.
Absolutely.
And I really felt like I did get some results from that.
Oh, that in itself is a modality that's very useful.
So you use
Absolutely.
several different modalities with your practice and everything, and I wanted to just talk a little bit about the concept of acupuncture. I've talked to a lot of people when they think acupuncture, oh no, no needles, no needles. In fact, I originally kind of thought that until I was in that mindset as well, that there has to be some alternative methods to surgery and drugs and aspirin, painkillers, to a very severe shoulder injury I had when working out with a personal trainer that had me doing shrugs. And this was before I knew you, and I went to a gal, Chinese gal. She did speak English, though, and I can't even tell you the results that I got. And I was not the least bit fearful when it came to those needles because, well, you guys, got to know what you're doing for one thing, and you can hardly even feel those.
Most people are apprehensive about the needles. And usually, if you see acupuncture in the movies, it's in some kind of horror movie like Pinhead, Kung Fu Panda. Okay, they're doing something either barbaric or really weird with them. And the size is very exaggerated.
Right.
So it does give someone who's never seen an everyday acupuncture needle in practice the wrong idea.
We
don't stop the heart in the office. We don't tweak facial nerves, and you don't fall on the floor off the table. You know, it is so much thinner than the actual needle you would get if you got a vaccine or a blood draw. It is so much thinner. It's a solid needle. The Western needles, when you go to an office visit, they're a hollow, three-edged, pointed needle that does tear the tissue as it goes in. An acupuncture needle is solid. It has a round tip. It just kind of slides in. Some of them are silicone-coated. You hardly feel them, if you feel them at all.
Okay, and I
so
can
people shouldn't. And here's what I do in my office, because it is a big problem. It is, because we go by referrals, right?
Sure.
My patients get better and they move on, and you should come 4 times a year for a tune-up, but you can't run a practice on someone coming 4 times a year, so you have to get referrals.
Right.
And everybody has a friend that has a problem that should come, but they're scared of needles. So I now tell them to bring your friend. They can try 1 needle for free.
Oh, that's a good idea.
Okay, so they're not getting an intake, they're not getting a complete treatment, they're not signing up for anything. They're just going to come in. I'm going to show them physically, this is an acupuncture needle, and we're going to put 1 needle in, and everyone is so amazed as to how painless it is and how they're not bleeding out when it comes out and how it wasn't sharp and how it didn't hurt. So I find once they try the 1 needle, that sort of eases their mind, and then they usually sign up for an office visit.
And that's really nice of you to do that, because it takes that fear factor away. So acupuncture goes back for centuries. It's
about 5,000 years.
It's been around a long time. There must be something to this. So can you explain how it works? Okay, when you do a treatment, regardless of what it is, and we're not making any claims here or anything like that, but as an alternative method, there's so many people out there that, these are facts. I don't know exactly what the statistics are, but they're way too high on people that are getting hooked on prescription pain pills. So if there is an alternative to help with something like that or other issues, how does it work in the body? Does it connect to those pressure points? Explain that to me.
An easy analogy is, let's say you have a plant in a pot outside and it's lacking water. It's kind of withering. It's not looking too good, right? Your first response is to put some water on it and it'll get better.
Right.
So what if you have a hose that's kinked? And you turn it on and you're holding the hose and it's kinked and maybe a drop or 2 of water comes out. That's not going to help the plant. So if you unkink the hose so the water is flowing smoothly, then you can water the plant and the plant is going to revive and be great.
Makes sense.
Acupuncture works with imbalances in the body. Something is blocking the flow of energy. So some areas have too much energy, some areas have too little energy. The acupuncture needle is just a tool, like a carpenter would use a hammer or some other kind of tool. The needle is really just a tool we use to smooth out the flow of energy in the body. It's really that simple.
That is very easy, simple. Absolutely.
It's simple. That's as simple as I can explain it.
That is, I can totally see that, because if you do have blocked energy and the needle goes in, it just kind of like opens it up.
Well, the needle's like a tool, so we actually do hand manipulations on the needle sometimes to move the energy in different directions. So the type of needle we use, the way we use it, how long it stays in the body, whether or not we use moxibustion in addition to the acupuncture, different things can affect the way the needle is going to react in the body and how it's going to move that energy.
And depending on what a patient is complaining about will determine like how many treatments they may need and how long they sit with the treatments. And I know you use like a heating lamp from time to time.
I use what's called a TDP lamp, and the rays from a TDP lamp actually travel further than the far infrared rays.
Oh, okay.
So it's not quite a heating lamp, it's a TDP lamp, although it does emit heat.
Yeah.
So I can see why it's a type of heating lamp. But specifically, those TDP rays travel all the way to the bone level.
No wonder. Wow.
So that's just a wonderful little, thing we have in the treatment rooms.
Right.
Like that. Acupuncture is one part of Oriental medicine.
Yes.
So that's just, the needles are just one tool we use. In Oriental medicine, there's many things we do, and there are some patients that don't get needles at all that come in. For example, if someone has a blood clotting disorder, acupuncture is the last thing they need.
Oh,
right?
yeah.
They should not be stuck with anything. So
Right.
that's somebody that might be a Chinese herbal patient, or someone that might be a homeopathic patient, or someone that would benefit from moxibustion. We have cupping, we have gua sha, we have other techniques, and in fact, we have some little devices that just emit an electric charge into the acupuncture point. So no needle is involved. It's just a probe with a rounded tip that doesn't penetrate the skin. It doesn't break the skin. It'll just emit an electric charge right over the acupuncture point.
And what does that electric charge do? Just kind of...
It moves the energy.
Moves the
like
energy.
We can set a dial on the probe
So
either
high or low?
tonify or sedate. It can push the energy, pull the energy. It will do this similar thing that the needles do, but much quicker and without the needles, if that's an issue for some reasons, with young children, for example.
Now, see, I didn't know that. I didn't know that you did that.
Yes, we do
I
that.
went right for the gusto. Just,
you went right for the needles.
Give me the
and that's
noodles.
fine.
Give me the needles and get in there.
Right. But in pediatrics, a lot of times we use this just little electric zap. On the acupuncture point.
Yeah,
we don't stick young children with the needles. They're not going to sit still for the needle retention time. So we come by with the little zapper, and it works great.
I love it.
It works great.
We have a commercial break coming up. I also wanted to mention that Dr. Mary actually has some specials for all of our prime time TV viewers. So you'll want to go to her website and you can see more about Mary. It's www.healingartsandwellnesscenter.com. So she has a special worked up for you if you wanted to try acupuncture or have a consultation with Dr. Mary. Now, I also want you to stick around. I want you to hear about what we're going to be talking about in the last segment, because I have been a patient under Dr. Mary's care, and we're going to be talking about weight management. And this has been, what, a couple of years since I've been under your care.
Yes, we're going to talk about that, Barbara.
Yes, and I'll share a funny story with you on how we collaborated this little venture. But stick with us. We're going to take a break, and when we come back, we have more talking about Oriental medicine.
Thank you.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
Everyone's story is different, so why be limited to just one or two options? With Norcom's Norflex Home Loan, you're given the flexibility to tell your story. Pick your terms from 8 to 30 years, all while maintaining a low, fixed mortgage rate. You can pay off your loan more quickly or choose a term based on your budget and timeline. Whatever you do with the Norflex Home Loan, make it part of your financial plan. Norflex. Short-term, long-term, your terms. Apply online at norcommortgage.com.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Hi, everyone. Welcome back into Primetime TV Show. I'm your host, Barbara Marville Kelly. With me is Dr. Mary Kelly. She's Doctor of Oriental Medicine, and she's actually sharing a lot of different options that you may want to consider at some point in time to help yourself, maybe with whatever issues that maybe you've tried in the past, or maybe you haven't yet. Maybe you're letting some things linger because you're just not sure which way to go. I am such a firm believer in integrative medicine, still from the old school to some degree with, regular board certified medical doctors and everything, but you're board certified in acupuncture. And I've actually had treatments from Dr. Mary, and we're going to be talking about some of the different modalities that you offer in your practice. I hope I can say this. Gua sha.
Gua sha. Very
Gua
good.
sha.
Very good.
So
that's just a gua sha translates to scratch purple. So it's a scraping type technique that we usually do in the back and neck area for one or two reasons. Either someone has chronic pain for an accident, and it can be an accident they had years ago. Sometimes you have aches and pains that just hasn't cleared up.
Mm-hmm.
And
something lingering?
Some lingering pain. The gua sha can address that. And it's stagnant blood that has broken out of the blood vessels that are at a very deep area in the body. And the gua sha brings it more to the surface where different cells can address that and kind of clean that up.
So it helps to like recirculate the blood, like sort of, or get circulation going?
From a deep level, yes, you could say that. Or if someone's having respiratory problems, a lot of phlegm in the lungs, we actually do it over the lung points in the back, and that actually helps break up that phlegm, and it helps the body expel it faster and easier.
I see. And then you also have cupping. Now, I've heard of cupping.
Cupping, and
they're literal. They are actually cups, right?
Sure.
So how does that work?
There's different ways to do cupping. Fire cupping is one of my favorite ways. So we're going to use a fire to remove the oxygen to form a suction. So we use cupping similar to how we use gua sha in pain management. And the cups are just applied and left on there for a few minutes. And sometimes we do what's called sliding cupping, which is where we slide the cup back and forth along an acupuncture channel. That would be an area with unresolved pain issues. And a lot of times one treatment can make a fantastic difference.
So that's another option for people that maybe don't necessarily want to go the pain
Either
medication
don't need
route,
needles or don't even want needles.
Right.
They come in and get some of these modalities, absolutely.
So they can come to you thinking, well, maybe they're not really sure about acupuncture with the needles, but then, and if they rule that out, then you do have some of the other
Oh, absolutely. Or some people come in just as herbal patients.
Yeah.
Things like that.
The whole theory and concept behind acupuncture, again, we were talking about many, many years ago. This has been around. And of course, coming here to the United States, and Mary was saying, in case you're just joining us, that you went to a acupuncturist, Chinese person that you couldn't even understand English.
Oh, no, I didn't speak a word of English.
And she didn't understand American, but yet you communicated.
Well, a highly trained doctor is a highly trained doctor. They know what's wrong with you.
Yeah.
And how. You're probably wondering how without lab work and without blood tests. And that was a mystery to me years ago as a patient. But I can tell you now, and it makes perfect sense, what we use is called tongue and pulse diagnosis. When you get your pulses taken in Oriental medicine, we're taking the organ pulses. So we're taking 6 different pulses on each wrist. So we're taking a total of 12 pulses that have dozens of different possible qualities. And the quality of these pulses reflect what's going on in that particular organ system. So that's a method of diagnosis we use in an initial intake right in the office. We also ask the patient to stick out their tongue, right? Who hasn't done that in a doctor's appointment? But we take that very seriously, and each area of the tongue responds to a different organ system. So we can tell what's going on way inside the body by the tongue coating, where it's laying on the tongue, what color it is, if the tongue is peeled, the base of the tongue, the colorations. So all this is diagnostic material that is our lab work. We don't need to draw blood to make that determination. So through the tongue diagnosis and the different pulse diagnosis, we come up with a treatment plan.
That sounds really
So that's how the
interesting.
doctor doesn't even have to speak your language, and they can know what's going on with you and know how to address that problem with a proper treatment plan.
That's how they
Absolutely,
did that.
absolutely.
Without any communication,
Right.
just by doing the pulse.
Right.
Pulse. Wow.
It's almost better if you don't talk.
Yeah.
A good patient is a quiet patient.
There you go.
Because you got to listen, you got to feel, you're observing, you're making mental
Sure.
notes, and they want to
Sure.
talk about 200 things.
So that must be why when I first came to you, you said, Barbara, no, you're going to have to be quiet, right? That's a hard thing to do.
It's more helpful.
Yeah, but we managed to get
But
through
yes, that's how that works.
Very nice.
And that is, a lot of times for certain conditions, we also request Western lab work. I do refer to a local lab, and many of my patients do get lab work on a regular basis.
And in that you do this in conjunction with the pulse work that you do.
Oh, absolutely.
And so
it
they
all makes a big picture.
Big picture,
A big
and they both
picture.
coincide.
Absolutely.
Ah, so the blood work can verify and vice versa.
Yes. Yes.
Love that.
Absolutely.
That's very interesting. So you've been doing this for how many years? 30 years?
No, I've been a patient of it
30
that
years,
long, so
that's
I've been
right.
around it that long. I've been treating patients since 2003.
Wow. Wow.
Now, I did an internship in China in 2001, so I worked at 4 TCM hospitals in China, where I interned with some of the best doctors in the world.
Wow, that had to be an experience for you.
It is, because the doctors there are generational. They're 7th generation doctors, 4th generation doctors. It's not somebody that just wanted to become a doctor. Over there, I was in Zhejiang province. Doctors, it's a very low paying job. They all ride to work on broken bicycles.
No kidding.
They make less than garbage men, because the country of China wants to make sure they're in it for the right reasons. And that's, they want to help people, and they have the skill. So their parents were doctors, their grandparents were doctors, their aunts and uncles were doctors. So they have this huge family history that contributes to their academic education over there to become doctors. I would feel comfortable seeing any doctor in China, because they don't last if they're not any good. They don't have malpractice, they don't have... Nobody gets sued over there. They don't have the legal system we have here, but there's a lot of pressure on them to do a good job.
Sure. So I heard that there was a hospital in Beijing where it's a hospital you go there to be well, to keep yourself well, not necessarily to go in because you are sick. And Master Kelly was explaining that to me, and it made a lot of sense, because of it. And what you're telling me here is that code of ethics and everything that they abide by and doing the right thing, and they don't even get paid very much over there.
They don't get paid very much at all, so they're really in it for the right reasons. And of course it's excellent for preventative medicine, but at the beginning of each change of season, which is roughly 4 times a year, our body's energy gets thrown out of balance as all these natural changes occur. Leaves fall off the tree, the temperature changes, the heat index changes. All these weather patterns have an influence on the organ systems in our body. So that's when someone should come in for a tune-up for preventative medicine.
Oh, that's why you say a
we-
tune-up 4 times of the year?
Absolutely. So we do seasonal treatments. The
Okay.
spring is a time that corresponds to the liver and gallbladder. So if someone is coming in with no complaints, but they just want to be healthier, they're going to get a balancing treatment on the liver and gallbladder because it's spring. And that's a great time to do that. Here in the winter, we're looking at issues with the kidney and urinary bladder.
This time of the year?
This time of the year. So this is a
Really?
great time for anyone that has kidney problems. They may flare up this time of year. For anybody that has bladder problems, they may flare up. This is a good time to get a handle on those and get a treatment for that.
And I just wanted to mention that Dr. Mary is offering our primetime TV show specials. If you want to get a hold of Dr. Mary, we'll get her website up and everything. We do have a break coming up, but I also wanted to mention, for those of you that are also, and here's your website right here.
Oh, thank you.
I
Thank
love
you.
the white owl.
Thank you. And I update it every month, so there's a different picture. I thought that was wintry, and the owl looks wise.
Yes.
So I went with a white, wise owl for winter.
Oh, that's refreshing. Absolutely. And then towards the, a little bit later on in the show, we're going to be talking about weight management. And I never even dreamed that I could use acupuncture for weight management. But Dr. Mary showed me a way, and I kind of fought her a little bit. In fact, at one time, I think I said, "Really? I think you're crazy if you think I need to do that, all that.
Wait,
and lose weight."
patience. They complain the first couple of weeks. Most of them do.
I fought you. You remember with that? Yeah. So that was very interesting. And you know what? Every patient is different for whatever modality that you go through. But we have all these different choices today, and I have found for myself, I can't make claims for anybody else or anything, but for me, by being accountable for my health and looking into some of the alternatives, for me, it's really worked. And we're going to share some more things, the different little things that you can do for weight management, like the food math. Keeping a diary, and we're going to be coming up with that. I have my own diary, came up with my own program, and Mary and I collaborated on this, and it really worked out very, very well. So stay with us, and if you have any questions, if you want to go on Facebook, you can either private message or just do a regular message, and I will get it right here on my pink iPad. So we're going to take a break, and when we come back, we'll have a lot more for you here with Dr. Mary Kelly, board certified in Oriental Medicine. We'll be right back after this.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
Everyone's story is different, so why be limited to just one or two options? With Norcom's Norflex Home Loan, you're given the flexibility to tell your story. Pick your terms from 8 to 30 years, all while maintaining a low, fixed mortgage rate. You can pay off your loan more quickly or choose a term based on your budget and timeline. Whatever you do with the Norflex Home Loan, make it part of your financial plan. Norflex, short-term, long-term, your terms. Apply online at norcommortgage.com.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Hi there, welcome into Primetime TV Show. I'm your host, Barbara Marville Kelly. We gave my other half the day off. That would be Dennis Kelly. He's probably home getting ready for some big events that he has going on. But I have been wanting to have Dr. Mary Kelly on our show for a long, long time. And I also failed to mention that Dr. Mary Kelly is one of our top fully fledged certified professional Tai Chi instructors in the Spring Hill area. So you can go to Dr. Mary. And how many levels are you at now? You're working on your gold now.
I should have my gold in the next week or two when Kelly's available to test me.
I know. Well, we'll make that happen. You can come to Timber Pines.
Yes, but they can go to my website, healingartsandwellnesscenter.com. There's a link on the left that says Tai Chi.
Very
that
good.
has class information right on there.
And if you want to get a hold of Mary and start a class in your subdivision, if you want to do private lessons with her, she's available for all of that. So it's all good. Mary's really one of our top instructors.
Thank you, Barbara.
I was watching you last Friday at class. Now this gal, I actually periscoped us.
Okay.
While everybody was exercising and doing the moves and everything. Mary's form is amazing. You move so beautifully well. You're just so fluid, and you can see that you really feel the movement and what you're doing.
Oh, thank you very much, Barbara.
Yeah,
I really love the Tai Chi USA program. I love our forms, and I'm having a ball with it, really. It's an interesting dimension to add to my practice.
I was just going to say it goes hand in hand with what you're doing.
It does.
Yeah.
It does. And it's got such a high Qigong content in the Tai Chi program. That's one reason I love our program above anybody else's Tai Chi program is all the Qigong we do for the warm-ups, the 6 quick fixes, everything we do to get ready for the Tai Chi.
Well, the other thing, too, is the Qigong with the special breathing. And, of course, being a doctor of Oriental medicine, the importance of getting oxygen to the cells. I mean, how much better healing can you do than your own breath work in getting oxygen to the cells? It's pretty amazing.
It's great because someone can come in who has never done Tai Chi or Qigong. They can do a 1-hour class and they can leave feeling better.
Yes.
You can take someone who's never worked out and put them in the gym for an hour and they're going to leave feeling worse.
I know. That would be me.
But with our program, everybody leaves, said, wow, I feel it.
Yes.
I feel it.
Yes. This is something that you can feel right away.
Yes.
It's really great. So I wanted to make sure that I mentioned that about Dr. Mary. Take advantage of her specials for just our viewers on Primetime TV show. But now I've been talking about weight management. It is such a buzzword out there in the marketplace. It's all anybody ever talks about is weight management, lose weight, gain weight, whatever. What's the best secret that we can do? Well, there is no secret, okay, other than one word that I will give, and that's accountability. When you can become accountable for your weight, whether you want to lose weight, gain weight, or maintain your weight, it's one of the best things that we can do for ourselves because it really helps us set our bodies up for the better quality of life, and it also sets us as being an example for our families and generations to come. So I'm going to share with you my visit to Dr. Mary's clinic a couple of years ago, and she said, let's see, you started coming to us to become an instructor and everything, and then we got to know one another, and I had already had acupuncture years prior that I felt really confident that really did help a shoulder injury. I did not go for surgery. I wasn't a candidate for surgery, but I was in 24/7 pain for 3 months. And so I was a believer in this healing art, acupuncture. So when I heard Dr. Mary was a doctor of acupuncture and Oriental medicine, I thought, I'm going to give this a try. So Mary gave me the protocol. I said, this is what I want you to do. This is how much food I want you to eat. And I said, stop right there. I can't do that. If you want me to do that, I am going to gain weight. I will balloon right out, okay? Well, we kind of fought back and forth with that nicely and laughing and all that. She won. Just trust me, she won. And she had me doing the food math, and she had just this whole protocol and everything. And I really thought that if I ate all that food and all those calories, that I really would gain weight. I lost weight, and I lost it and kept it off. And I have to praise you for all of that because you really opened up my eyes to, food really is our best medicine. If we know what to eat, how to eat, when to eat, get your exercise and all that, and you just put together, this is your own protocol.
It is.
So
It
nobody
is.
else has this. And that's why I've been waiting to see if it worked, because I tell you the truth, I didn't think it was going to. The acupuncture, yes. But eating all this food and doing all this and that, and having some of the acupuncture treatments, that was something new for me. So let's talk a little bit about that and the people that you work with and what's been going on with that.
Well, I'm so glad you didn't use the D word, diet.
Oh, diet.
Okay, because diet's a bad word. If you're talking about a quality nutrition plan and you're managing someone's weight, diet doesn't fit into that whatsoever. You know, we want to use nutrition plan, we want to use weight management. It's making better choices is the bottom line. If someone is overweight, they are making bad food choices. And there's no way to skirt around that.
Right.
And they can say, someone said this, I saw this on TV, I read this book. That's almost the worst patient is an overeducated patient.
Right.
Has listened to 10 different people on 10 different plans. They're all conflicting. In weight management, and some people are trying to gain weight, but which is usually muscle mass, okay? But in most cases, the people I see are trying to lose weight. So I'm speaking more from that point of view. If you're below a certain amount of calories per day, your body is going to store fat. And that's what people don't realize. They think if I eat less, I'll weigh less.
Right.
But that is false. And I don't know how that got started. And another vicious rumor is if I eat salad, I'll lose weight.
Oh, I know.
And trying to tell someone that's coming to me for weight loss, you cannot have salad.
That blew me away when you told me that.
And you're not the only one. You're not the only one. You cannot eat salad and lose weight. That's not going to work.
Tell us why.
Most dressings put you over your fat grams for the day is problem number one, okay? Nobody wants a dry salad. Problem number two, if you're coming to lose weight, you already have a little bit of a digestive problem you're unaware of. Eating something raw, in fact, my weight loss patients or my weight management patients that are trying to lose cannot have any raw fruits or vegetables. It's damaging to the digestive system. The body has to waste too much energy to get that food to the proper temperature to try to digest it.
Really?
Really. It's a waste of energy that could be going to your muscles, to your ligaments, to your joints, to your tendons, to just burning fat. You're taking energy away from fat burning to try and cook this food that you wanted to eat raw, when you would have been better off with a grilled chicken breast, a cup of rice, a cup of steamed vegetables. That's first of all better to eat than the salad. That's going to give you more nutrition and you're going to get better results. But it's all about the food math. I do personal nutrition plans as part of weight management, and everybody has their own personal plan for their lifestyle, for their constitution, for their age, and for their goal. So you have to maintain a certain calorie range and a certain fat gram range. Protein levels are added after that. They don't start without protein. Okay, you have to have carbohydrates, you have to have protein, you have to have some fat, but you have to understand the math of the food you eat. There's so many programs out there that have done this counting for you, and they want you to buy these prepackaged meals. And there's a bunch of number ones and a bunch of number twos and number threes, and you can maybe have one number four and two number twos. And what they've done is they've hid the food math from you. I educate my patients on how to calculate that themselves so they can shop at any grocery store.
That's wise.
And if you're buying into that prepackaged food plan where somebody else has done the counting for you, and every patient starts out saying, I don't want to calculate all that. I don't want to be accountable. I want to pick up a number two. I don't want to look at the label. I don't even want to know what's in there. The problem is when they've stopped that plan that does the counting for them, do you know what's going to happen, Barbara?
They gain it back.
Of course they do, because they don't understand how to do the food math.
Because it was a mystery. It was kept a mystery.
Right.
But it's so much easier to have
Once
it
you
all.
understand how to do it yourself, it's a lifelong
It is.
plan you can stick with.
And it's a choice. It's a choice to
absolutely.
do that. And I mean, let's face it. We come and go with the so-called diets. There's all kinds of fads out there and everything. But when you become more accountable, I don't know, there's just something more satisfying.
You have to understand the numbers in everything you're eating and drinking.
Right.
And it's if it doesn't add up, it doesn't add up. You know, that just wasn't a good choice for you that day.
Yeah.
And so there's so many things you can do to get started for free. You can go to myfitnesspal.com for free and you can start a profile. Now, I don't agree with them 100%, but in most cases, the little pie chart they give you, the little recommendations they give you are going to be better than what you're doing on your home at home on your own.
Right. Right.
Okay. Now, I'll tell you how the acupuncture figures into this. I have a different monthly special going on right now for weight loss, where someone comes in, we do the food plan, they get the acupuncture, and we also do the B12 injections into certain acupuncture points. I like to use the B12 because that increases the body's metabolism, so you burn fat faster.
Okay.
So that's a little trick we do to get results, is the B12. Oral B12, you're losing 60% of that through the natural digestive process. It's so much better to do the injectable B12 into the acupuncture points. We don't inject into the fat layer. This isn't a muscular, an IM shot. It's right into the acupuncture points. So we directly target the abdomen, the thighs, the problem areas with the B12 right to that area.
So
But when we use the acupuncture needles, we insert them into muscle attachments in the problem areas, as well as some constitutional points, and we use what's called E-stim. Most people are familiar with electric stimulation from a chiropractor. Acupuncturists have a different kind of box which has different clips. We don't have the sticky pads. We have little alligator clips that go right to the needles. So when we send an electric current through these muscle attachments, it's the equivalent of doing a bunch of crunches. If you went to the gym and got on a mat and did crunches, you're telling that muscle to contract to sit up.
Yes.
Well, you can lay there with music, relaxed, and this is the one day a week I tell you not to work out, is when you're getting this treatment, because we're going to run electricity through the muscle attachments that start to tighten the abdominal area or the thigh area, whatever problem area we're working on.
And it does not hurt. At least it did not hurt for me.
No, it does not.
I looked forward to it, to getting those
It's relaxing.
treatments. It was
It's
very
very
relaxing. And I'm always up for pioneering things and trying new things in so many of my life experiences, so I didn't mind giving it a shot. And like I say, I mean, I fought Mary nicely. I said, Mary, if I eat all that food, I'm going to gain so much weight. Well, once you explained the food math to me, and I started becoming more accountable and watching my fat intake, watching my carbs and everything, getting my exercise and getting my treatments. And I think we came once a week, right?
Right.
And
It's my typical protocol is once a week for 12 weeks.
for 12 weeks. And believe me, I
And
felt
Barbara,
so
you're
much
not
better.
the only one. Everybody thinks they cannot eat more. On my nutrition plans, patients are not hungry. They are struggling to hit their minimum calories.
I know. Remember,
they are struggling.
I would go to Mary with my book and just go, "You're not eating enough. You're not eating enough." Once I accepted it, I wanted to eat more and I wanted to meet that goal. But I was not hungry, so I didn't want. I had to.
You have to force
force
yourself.
feed
Absolutely,
myself.
you do.
Because the other theory and the understanding is I mean, you need to be burning this and eating. It's better to eat more small meals in a day than like 3 big ones. Correct?
Well, that is correct, but I really target your fat intake.
Exactly. Hold that thought. We're going to be talking about the fat intake too, because there's a whole bunch of stuff going out there about fat-free this, fat-free that, and all that. Stay with us. We have one last segment with Dr. Mary. We're going to talk more about weight management, give you some tips, and talk about some specials she's offering right now for you.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
Everyone's story is different, so why be limited to just one or two options? With Norcom's Norflex Home Loan, you're given the flexibility to tell your story. Pick your terms from 8 to 30 years, all while maintaining a low, fixed mortgage rate. You can pay off your loan more quickly or choose a term based on your budget and timeline. Whatever you do with the Norflex Home Loan, make it part of your financial plan. Norflex. Short-term, long-term, your terms. Apply online at norcommortgage.com.
This is one bee that loves going to the dentist because it's made for you and me.
My name is Dr. Becerra from New Tampa Pediatric Dental, providing a comfortable atmosphere in early dental care. Gives kids a great start for healthy teeth and gums for life.
When I go to Dr. B, they don't do anything to hurt you.
I used to be afraid, but I'm not now. I'm not afraid of the dentist anymore. I love to see Dr. B. Call New Tampa Pediatric Dental today.
Hi, everyone. Welcome back into Primetime TV Show. I'm your host, Barbara Marville Kelly. Wow, this hour is going by way too fast. We have Dr. Mary Kelly in the studio here, and she is actually going to be sharing some things on weight loss that, I mean, I have to laugh when I think back to 2 years ago, Mary, that when I fought you about losing weight and all the things that you were telling me that I had to do, and I'm going, really? I got to eat all this food? I'm going to gain so much weight from this. But you know what? I listened to every point that she did eventually, and I lost a sizable amount of weight, several dress sizes, and I can't thank you enough for that, just by becoming accountable and listening to your expertise. And this is Mary's own protocol. She's put this weight loss program, this weight management program together. And of course, everybody gets different results, but you might want to contact Mary. What are some of the key factors that is successful for your weight management program?
Patients have to stick to their appointments. You know, they need to come once a week for the 12 weeks.
Okay.
Okay, and after the 12 weeks, you may need to continue with your nutrition plan, but you're well on your road to success. Some people have a considerable amount of weight to lose, so you're not going to lose large numbers in 12 weeks, but I feel like I give you the education and the tools you can use to maintain that on your own.
Well, you know, having the tools is really the biggest thing, and the education, because there is so much stuff out there. Just when you think you're supposed to be eating fat-free this and fat-free that, that's just not good for us. We need to have fats, right?
Well, people need to stick to their plan, and you get a certain number of fat, but most people, it is way too high,
Right.
way too high.
Right.
And there's some different tricks to understanding where you need to be and what food choices you need to make. So I encourage patients to keep a cooler in their vehicle. You know, the number one mistake is I was hungry, I wasn't home, I had nothing prepared, nothing cooked. I drove through a window and got my lunch.
Exactly.
Okay, number one problem, you should have had a cooler in your vehicle and you should have been prepared.
Sure.
So, you know, that's on you. So accountability. Once again, you have to understand the numbers in what you're eating.
And also what you taught me about, you know, having healthy snacks and not just grabbing for the chips and grabbing for this or that, but every once in a while, if I would cheat a little bit and have maybe just a couple to satisfy and give me that satisfaction of something salty or whatever, but I was pretty good with it. And thanks to your guidance, because it's funny, once you get on a good meal plan, you don't want the junk.
Right, you're not going to crave that.
You just
You're
don't
not
want
gonna
that
crave
anymore.
Absolutely.
That's
That
what
is
I
so
found.
true. I would say most people are not drinking enough water.
Oh, thank you for
So,
saying that.
9 out of 10 patients, I increase their water intake severely. That's a big help. But just steering people away from the salads, away from the raw fruits and vegetables, that's a big milestone right there, is getting them to understand that's not helpful, that's not going to work. You know, I'm as goal-oriented for them as they are for themselves. And we've got to address this the right way. You know, there's no substitute for a cooked meal.
Exactly. Now give us your best cooked meal that people could enjoy, that like you
Okay,
used
now
to
I'm
do.
not Martha Stewart.
I
here.
know you're
Okay.
not, but
so I go for simple.
You go for
I
simple,
go
and
for
simple is good, and simple is affordable.
Okay. And I want to address the cooking in olive oil.
Okay.
Okay, that's not going to work.
Okay.
Because whatever you use to, you know, whether you're adding butter or olive oil or this and that, you still have to work those numbers into your nutrition plan.
Yes.
Both the calories and the fat. If you started with 3 tablespoons of oil and you have 1.5 left in the pan, you still need to count 1.5 and add that to that meal. And in most cases, that's a deal breaker. So you want to start by looking for a zero-fat cooking spray.
And there is.
There are.
Yes,
Barbara,
there's
they
a
are
lot
on
of
the
them right
market.
now, and an olive oil. I think Pam, and this isn't a plug for
Okay,
Pam,
so
but
that's a biggie. You've got to be
Yeah.
responsible for all your numbers.
Yes.
But I like the skinless, boneless, grilled chicken breast, a cup of steamed rice, and a cup of steamed vegetables.
and
Now,
there you go.
I like a bamboo steamer for the vegetables. I like a plug-in rice cooker. You add the rice, you add the water, you push the button. You don't have to watch it. You can walk away. You can go take your shower and come back and it's done.
Oh, that's nice. I can't tell you how many times I burn rice for my dogs.
No, go with a rice cooker. It's a simple thing. And some are really nice and high-end and ceramic. You know,
Yes.
your lower-end ones have the aluminum pot in there. But, you know, this isn't microbiotic cooking.
Right.
This is weight management. So if you happen to have an aluminum pot rice cooker, go with it.
Yeah. Well,
Go with
keeping it simple, it really
Keep it simple.
makes it more doable too. If you have to find yourself in the kitchen like several times throughout the day, I used to find that I'd cook in advance.
Yeah, absolutely. It's best if you're going to sit there and prepare these meals, prepare a couple in Tupperware containers, put them in the freezer, you know, be able to put them in your cooler and eat them later.
Exactly.
You know, take them to go. But you've got to have your meal plans prepared a day or two ahead of time.
That is one of
You
the
cannot do it on the fly.
That's the best education you ever gave me, was to plan those meals in advance, because that is when you have to cheat. If you're out and about, you don't have something to take with you in your cooler that you should have in your car at all times, especially down here in Florida. We need to have that for fluids and being hydrated and everything. But that was really the best education, was to plan those meals in advance so you're not reaching for the junk food or the drive-through lunches and things like that. You'd be surprised how easy, when you become accountable, and it's either 100% or just don't bother.
It's a habit. It's just a habit. And
Yeah.
it takes 21 days to change a habit, break a habit, or make a habit.
Exactly.
So the first 3 weeks are difficult. After that 21 days, it gets so much easier, and it gets to be a second nature thing.
It really does. I really got into it. I was really OCD with it because I was getting results, and I really believed in you and your education with me. So if you want to get a hold of Dr. Mary Kelly, feel free to do so. You can call her at 352-544-7619, or you can go to her website, which is www.healingartsandwellnesscenter.com, or you can also email her directly, floridaacupuncture@yahoo.com. And when you go to the website, as we were just showing you there, Dr. Mary has some specials going on for primetime TV viewers. So that's really great. Thank you for doing that. And it's quite a savings.
Thank you. That is an incredible deal. 4 complete weekly acupuncture treatments for $125. No new patient fees, no hidden fees, no office costs. All that's been waived for our primetime TV special.
Yeah, see that? Go and with the right people in the right places, right?
Absolutely.
See, and that's what we
Absolutely.
did just for you. I've been wanting to have Dr. Mary on for quite a little while because she's really helped myself, and of course also being one of our fully fledged certified professional Tai Chi instructors. She's at one of the highest levels in her gold, and she's also a master trainer where she can train and certify you as an instructor if you ever want to get into the Asian arts. I tell you, your career, your profession is so well rounded, and by adding the classes and all, it just
it's been wonderful.
makes the
And
best.
my Tai Chi students that have become instructors, that's just been an incredible experience to share that knowledge and to get it out there, because this program has so many benefits for health and wellness.
It certainly does, and especially for stress, relaxation. I think we need that today. A little bit of Qigong, special breathing, getting oxygen to the cells really helps you create your own
I've gotten
healing.
more testimonials about the participants' blood pressure being lowered.
Oh yeah, that's
In these Tai Chi classes, I'm hearing more and more how they got off their blood pressure medication, or it wasn't working anyway, and for the first time in a decade, their blood pressure is in the normal range, and from these classes.
Well, I
from
know
these weekly classes.
I notice that myself when I take the classes, and when I don't, there's a difference, and we're not making any claims or cures or anything like that. But you ought to try it sometime and get a hold of Dr. Mary Kelly. Go to one of her classes and just see, and also talk to her about her practice. And there just might be some modalities from Oriental medicine that just might be a positive outcome for you and an alternative in healing and wellness. And I want to thank you for joining us today, and I hope you'll come
Thank
back.
you, Barbara.
Maybe
I would
we'll
love to come back.
We'll
I
have
had a
some
great time,
We'll have
yes.
some spring specials going
Okay,
on.
that sounds wonderful.
And I want to thank you for joining us. I will see you next Monday, same time, same place. Women Unscripted is back by popular demand
Oh my gosh.
at live at 5. We'll see you next week. Stick around though, because we have a brand new show that's been launched here called Nerd Talk. You're going to love it. You're going to have a lot of fun. Thanks for joining us.
Thank you.
God bless. Have a great week.
Bye-bye.